Hello, everyone. My name's Hannah Poulton from HLP Therapy, as you'll know. Today, I'm joined by Dr. Tiran, and she's going to introduce herself in just a moment, telling us who she is, what she does, where she works for. But this is a very interesting recording, especially if you're a midwife. So, Dr. Tiran, thank you for joining me. Please tell everyone who you are and what you do.
Well, thank you very much for asking me. I'm Denise, and I am a midwifery lecturer. So I have been a midwife educator for most of my professional career. I only ever wanted to be a midwife, actually. I went into nursing because that was the thing that you did. And then I almost immediately went into midwifery training, worked for a short while in Surrey as a community midwife, and then went into teaching, and I've been in the southeast London area for, well, ever since, actually. And for quite a long time, I worked at the University of Greenwich, where I was given various opportunities for further training. And I became very interested in complementary therapies, which became my specialism. I was in a very privileged position at the right time, and I think that's what helped move things on. So I've left the university 21 years ago and set up my own company, Expectancy. So Expectancy provides a range of different courses for midwives, and we do sometimes have doulas and birth workers on the courses. We offer a range of therapy courses specific to pregnancy, birth, and the postnatal period. So we have things like aromatherapy and massage, acupuncture, reflexology or reflex zone therapy, which is a very specific clinical style. We also have study days. Many of those are online. So we have things like natural remedies and homeopathy, looking at specific issues, moxibustion for breech, which is a Chinese technique to turn a breech baby to head first, and a variety of other things. And I've been running Expectancy, as I say, for 21 years. And I have a small team who work with me. I do a lot of teaching for NHS trusts, particularly around aromatherapy, where they're wanting to start using massage and aromatherapy for labour, for example. And I also do a lot of teaching overseas. It dropped off during the pandemic for obvious reasons, but back to full force now. I've been teaching in Japan for about 23, 24 years. So I go every year, sometimes twice a year. And yeah, that's good fun too. But we also offer our own scheduled courses in person in London, and then many of them are online as well. And we've recently, well, no, not recently, we have been offering business training for midwives who want to offer complementary therapies in private practice, because making that move from the NHS into being freelance and in the big commercial world, as we both know, Hannah, is pretty scary. And then we've recently realised that, of course, not all midwives may want to specialise in complementary therapies, but they may want to be offering other private services, for example, the scar therapy or tongue tie division or lactation services. And we're now offering an extra business training course for those midwives who want to explore how to go into private practice, what the issues are for midwives who are working outside the NHS. And so that's getting going in October when we start our next academic year. So it's pretty full on, as you will know from being self-employed as well. You know, there's always something to be doing, but it's great fun. I love it. I love the traveling. I love talking to midwives about physiological birth, natural methods of helping expectant and birthing parents to have the birth that they want, really, and enjoy their pregnancy. It's a very stressful time these days, I think, isn't it? But so that's where I'm at the moment.
I think I don't know about you. Please, I love your opinion on this one. It's, I don't know why, but it seems harder. It seems to be more challenges for mums. Just even the labour itself, the amount of pressure put on mums, especially how you give birth, where you give birth, recovery. Do you find that? Is that what your midwives are saying?
Absolutely.
Yes.
I mean, I actually really worry for UK midwifery and in some other countries as well, because it is being subsumed into becoming an obstetric nursing profession, which helps obstetricians. And I think it's really difficult for women these days. You know, when I first started in the middle 70s, women got pregnant if it was going to happen. They often didn't work or they didn't work a lot, so they were able to rest and relax and absorb themselves into preparing for pregnancy. And, you know, there was no rush to go into labor. I once had somebody who went 4 weeks overdue and nobody blinked an eye. You know, it was fine. And I think these days, because women are having to work quite often and they're wanting to work, they want to try and work right up to the due date. And then, you know, they get more time with their baby afterwards. But there's that constant pressure. I think life in general is quite stressful, but I think pregnancy is very stressful and very tiring. And they go into labor and they're already exhausted. And then there's all this coercion, you know, we'll get you in for an induction next Friday, and this sort of attitude. And an implied blackmail, emotional blackmail that, oh, well, you are putting your baby at risk if you don't do what we say. And yet, actually, that is not what it's about, you know. And then, of course, they have the baby. They often end up with cesareans, as you will be well aware, or forceps births or whatever. They then, I think, some of them expect to jump out of bed, get back in their size 6 jeans, and carry on as normal. And I think that transition from being perhaps a professional person or somebody who had their own life and their working life and what have you, to becoming a mother, then it becomes very difficult. That role change, I think, is really difficult. And there's this pressure to be perfect. And
Mm.
nobody, of course, is a perfect parent, but I think there is a sort of competition between people they meet, you know, similar experiences, and well, I've done this, and you need to be doing that, and this sort of thing, which I think is, you know, is a continuation of a sort of societal pressure on them to do the right thing. And we seem to have lost the spontaneity of becoming pregnant. You know, you can have IVF and various other things if you're having difficulties, and that's right. It should be for those who need it, but you know, it's I think it's really difficult these days. And they want, you know, many of them will want the intervention, but more, I would think, do not want it. And
Yeah.
then they are pressurized, and they're already coming to us in the maternity services, believing that somebody's going to tell them what to do. And so they're already prepared for a battle or prepared to be squashed down if they're not, you know, an assertive type. We are seeing more parents choosing free birthing, where, you know, they decide to have the baby without any professional help in attendance. Um, and I'm not quite sure what I think about that, so that might that might upset a few of your viewers. But you know, I do believe that people are trained to become experts in certain fields, whether it's accountancy or legal matters or whatever. And I think free birthing is a really sad indictment of the way that the professions of midwifery and obstetrics have really changed in, you know, it's nearly 50 years since I started, so it's changed a great deal actually. And I think it's a difficult time for them. Then there's the clock ticking, you know, sort of the physiological clock. So women are often leaving, families are leaving it later to try and be pregnant for the first time. It's all sorts of factors, I think.
Mm. Yeah, and also I think social media has a big part to play, doesn't
Yes,
it?
yes,
When
yes.
I mean, it was fantastic in the Olympics when you see all these amazing athletes, you know, being pregnant and winning gold and archery and all of this. I I can't tell you the amount of clients that I had in that were deeply almost traumatized by that, saying, Hannah, I struggle getting down the stairs. And
Yes.
here you are, you've got somebody winning